Um, as I began, basically with school-based health in Lincoln County. School-based health centers started around in West Virginia around 1990, funded by the Claude Worthy-Benedum Foundation. Lincoln Primary Care was fortunate enough to get one of those grant awards to start a pilot project at Guyan Valley High School at the time. Guyan Valley High School, as far as the state was concerned, was one of the most productive school-based health centers in the state, and had been and continues to be productive. But since the student population there isn't as large, not as quite as productive as it used to be. And when I say productive, in terms of the number of visits and the number of consent forms and that type of thing that we receive. We send out consent forms every year to all the students in the county with your help and the school's help. It's a mass undertaking, as you can imagine. We try to get everyone's parental consent to be seen at our school-based health centers prior to the school year beginning. If they do not, we'll see them that first time, but then they have to bring their consent. We take great pains to make sure that we get those consent forms, and even on the day of visit, we'll make sure that we call the parent to let them know that we're seeing their child. We've tried to educate in the school systems. We've tried to teach the students how to access the health care, teach the teachers how to access and how to utilize, and to make sure and reassure that we're not there as an excuse to get out of class. Our goal is to get the kids back into class. Get them in, get them seen, get them taken care of, get them back to class. I've been president recently, I'm past president of the State School-Based Health Assembly. I forgot to put their website on here if you want to check it out. It's West Virginia. It's wvsbha.org. wvsbha.org. That's the West Virginia School-Based Health Assembly. Some good data, good stuff on there. Since starting school-based health, we have, it's an opportunity for us to provide access to care. Unfortunately, as we know, sometimes the only way the kids can get in to be seen with a medical issue is via the bus. We've seen that. We've had that. We're there for the teachers, we're there for the sports staff, your bus drivers, whoever else needs to be seen within the school. Typically, and it varies from school to school, it varies from county to county, it varies from state to state as to who has access to the schools. We have some, always have concern about safety and access and that kind of thing. So typically our schools are confined, and our school-based health centers are confined and only there for the kids and the service personnel and the teachers. As a benefit to the school and to the Board of Ed as an employer, it also allows your teachers to possibly slip down on their free period to be seen versus having to miss a half a day or a whole day to go in for a routine visit, or if they have a head cold or whatever the case may be. One of the teachers at Guyan Valley thinks it's great. She has some horrible allergies and has to go once a month for an extensive regimen of immunizations. And so she doesn't have to do that now. She can come over during her free period and doesn't have to miss a half a day of work. So, and for the parents, if they know that we have a quality health care provider there at the school that can see their child, they don't have to leave work or leave whatever they're doing, maybe even caring for an elderly parent, whatever the case may be, come and get them, take them out of school, take them somewhere else to be seen, possibly for a head cold that we can see at the school. We have, I just listed the schools that we have. We have recently opened one, as you'll see in this annual report, mention of Southern West Virginia Health System. Lincoln Primary Care was awarded a federal HRSA service area competition grant that allowed us to provide services in Logan and Mingo counties. I met with Wilma Zigman, who was a great person. She's funny, very excited about what we're doing, and just never let up. We're going to put a school-based health center in Chattanooga Regional High School or else. So we've worked with her. It is open. It's not full speed like we want it to be yet, but it's open and it's available. They're actually working on a plan with us to use one of their golf carts to make sure, because the feeder schools are nearby within walking distance, but they want a safe avenue for all the school children there to be able to access our school-based health center. So they even planned that center way before they came and looked at Lincoln County High School Center to kind of model off of it. So we had a space there ready to go. It was really kind of exciting to see. With the success of that, Win was hoping that we open one at Logan High School as well. So we have, since the Guyan Valley site, as you may or may not know, opened 2 other sites. Lincoln County High School opened. The Sisters of St. Joseph helped us fund some of that project and helped us pay you guys for some of the utilization of the space. And we've had a full service school-based health center there since the school opened. And I believe last year we had over a 90% consent form rate, which is outstanding. So we're real pleased with that. So the parents are responding, the kids are responding, and we're there to take care of them. Over there is Kelly McMinn. She's a physician's assistant. Dr. Bowen is at Guyan Valley. Because of the changes and trying to open up fully to the community in West Hamlin. Donna, she's trying to teach me about the other side of the hill. We have this ongoing too. So at Pleasant, we now have a center outside, which we work with the school to make sure that the school children can get there safely with an escort and that kind of thing. So, but they have access to a physician, and they get access before anybody that comes into our clinic, private entrance, and he can take care of them and get them back into class as quickly as possible. So that's a great thing. And shortly after Lincoln County High School, we opened the Duval Yellow Jacket Center for Health, and it has gone very well. We've had a great response there. The community has welcomed it, and it's well utilized. So, you know, our board did these things without any funding, and so we do bill insurances and that kind of thing, but we don't bill folks without their consent. We don't bill anyone without, if they don't have insurance. We have sliding fee programs and that kind of thing. Most of the kids will have Medicaid chips or private insurance, so it's usually not an issue, but in order to fund them, we have to. But I can tell you, and one of my board members is here, but we don't make money on this. So not that means anything to us. So that's the dedication of our organization and our board, is to get access to care out to the kids where they're at on most of the year. And so that's the important part. There are some statewide statistics on here that I won't go through, but you're welcome to look through them if you have any questions. But you can see back in 1990, we were one of the first. Now there are 56 school-based health centers in 61 schools in 24 counties across the state. So you can see how it's taken off both statewide and federally. The one interesting and what I consider to be a good thing, and I'm biased because I run a federally qualified community health center, is that West Virginia is a rarity, maybe one of the only states that all but one of our school-based health centers are operated by community health centers like ourselves. And what that does, it means it's a nonprofit piece. It is tied into a network of other organizations that share information, that get programs out to the kids, to the faculties at the schools. It has a different mission than some of the other states, which have for-profit hospitals running them and that kind of thing. They're there to do the right thing, but they're looking to profit and so forth. So it gives us a better advantage. It gets us back to maybe more of a grassroots kind of effort to get the care out to the kids that need it the most and provide good care to them. On the back side, you can see some of our encounter numbers on the second page in that chart. Some of the encounter numbers. Encounters are basically what we consider billable visits, which are not, we have billable, non-billable services. I won't go into the whole mess of FQHC billing, but a lot of what we do there is non-billable type services, which are non-nursing visits. The Guyan Valley